Understanding biosimilars. Biological medicines, often called biologics, are an important class of drugs that offer safe and effective treatment options for many diseases, including cancer. Unlike most drugs, which are made through chemical reactions, biologics are made by living cells. Antibodies are an example of a biologic. Standard drugs are made up of chemically identical molecules. But because of the size and complexity of biologics, these kinds of medicines can include subtle molecular variations. They have extremely small differences, even between lots of the same medicine. Given their source, this is normal, expected, and controlled within very tight limits. Think of it this way. Wine made from grapes is a biologic product. Grapes have slight differences from year to year or even from field to field, even when from the same vineyard, like a biologic. Bottles of sport drink, on the other hand, are always identical, being derived from a fixed recipe of uniform ingredients, like a standard drug. So now that we know what a biologic is, what is a biosimilar? The simplest answer is that a biosimilar is a copy of another biologic. You're probably familiar with generic drugs, or generics, which are copies of standard brand drugs. Generics are approved by the FDA by showing that they are chemically identical to the brand name drug or reference product. Given that they are exact copies, we already know the active ingredient is safe and effective. Biosimilars are like generics in that they are versions of brand name biological medicines made by a different manufacturer, just like generics are versions of standard brand name drugs. However, unlike generics, it is impossible to make exact copies of biologics. Remember wine? Instead, biosimilars must demonstrate to the FDA that they are highly similar to an existing biologic that has already been shown as safe and effective through extensive clinical trials. If biosimilars aren't exact copies, will they work the same? Yes. All biosimilars must be proven to have no clinically meaningful differences compared to the reference product, and this involves some clinical trials. So why do we have biosimilars? Biosimilars increase competition and choice and help treat diseases like cancer, arthritis, Crohn's, diabetes, MS, and others. Also, because biosimilars can rely on some of the work done to approve the reference biologic, similar to generics, there are fewer additional expensive clinical trials needed for FDA approval, which in turn leads to more affordable products. Since they work the same but cost less, a biosimilar may be the first choice of your physician or healthcare plan. The other way you might encounter a biosimilar is that your pharmacist may select it as a less expensive substitute for the brand name biologic on your prescription. However, your pharmacist can only do this if the biosimilar has been designated as interchangeable with its reference product by the FDA based on additional clinical studies, and your doctor allows such substitutions. Regardless of whether you receive a biosimilar from your physician or your pharmacist, the bottom line is that biosimilars offer safe, effective, and potentially less expensive treatment alternatives for patients.